Statistics and data science can help save lives and inform policy around the world. And it all starts from statisticians in academia, industry, and government coming together to learn and exchange ideas. It's happening right here at the Joint Statistical Meetings, and we're JSM TV. Hello and welcome back to JSM TV. This is our second episode. We're so excited to be bringing you the show from one of the largest statistical events in the world. We have more than 5,000 statisticians attending over 600 events. So impressive. And today we're going to take a deep dive and look at the impactful role this field can have on health. Let's see what's coming up.
We're particularly concerned about prediction models for suicide risk and self-harm. Some of our prior analysis found the potential for differences in performance of suicide prediction models across different racial and ethnic groups.
We'll take a look at how statisticians can correct for structural racism in clinical prediction models.
JSM is one of the largest gatherings of statisticians in the world. For me personally, what I get out of the meeting is I learn about latest developments in the field.
And hear from some of JSM's international organizations.
We have all these great people that do really advanced statistics, but we want to make sure that the focus is always on how can we actually apply that to the world and help save as many lives as possible.
We'll also continue our tour of the country's top research, this time looking at groups doing great things in the health sector. Whether you're here in Portland, Oregon, anywhere else in the world, there are lots of ways to watch JSM TV. Watch it on screens around the venue, in your room in select Portland hotels, via the JSM website, or on our YouTube channel, including extended versions of all our film series features. And make sure to connect with us online. Now to the JSM TV studio for our first interview as we get started on our mission for health. Time to take a look at how statistics can inform public health policy as a whole, but particularly when it comes to looking at one of the bigger issues of our time, housing and homelessness. I'm joined now by Duke University's David Banks. David, it's so nice to meet you. Thank you for taking the time.
It's a pleasure to meet you. Thank you.
Yes, yes. So let's talk about how can statistics play a role in some of these public health areas, particularly mental behavioral health, housing, homelessness, really important issues that we're all trying to solve.
The expert on this is Dr. Suparna Das, and unfortunately she is not able to be here, so I am going to be an inadequate substitute for her. Substance abuse and the Mental Health Services Administration is terribly important for addressing these problems. Obviously, mental health plays a large role in homelessness, and there's a recent Supreme Court decision allowing municipalities to remove homeless people from public lands is going to have unexpected consequences. The Substance Abuse and Mental Health Services Administration is playing a vital role because we need to know how bad the problem is, whether it's better than it was or whether it's worse than it was. Angus Deaton and his deaths of despair was, of course, a critical event in understanding how the mental health and substance abuse problems are emerging in the United States. Dr. Das's work is trying to roll this forward in a way that casts a light on the magnitude of the problem.
We have some young, brilliant minds going into the field of statistics. What advice would you have for them, especially when they want to go into the field that you're in and applying this to help with public health?
I'm really old, so my advice probably is not very valuable to people. But for young people, I would say read widely, not just in the statistical literature, but also in policy. Read widely in history. Talk to experts in other domains. I would encourage you to look to large language models. I think those are going to be transformational. I don't know what role they will play in things like the public policy challenges that we're all facing, but I think they're going to have to be a critical component of any progress that gets made. I worry about our system of governance. I'm not sure that we are as effective and efficient as we need to be. a lot of the guardrails have come off. Our society is moving forward in unusual ways, and the checks and balances that we have had in the past don't seem to be working as well. And so I would encourage young people to think about how they can maximize their impact for good in the world. It's going to be a challenge for everybody. I feel sorry for the next generation. I think they're going to have hardships and adversity that I fortunately was able to sidestep. But young people like you are going to carry a heavy load, so good luck with it.
Oh, I love that you include me in the young people. David, such a pleasure to talk with you. Thank you.
Thank you.
Some work there that can have a real impact on people's lives. Now, for our first featured research group of the day, as we look further into health, the Department of Biostatistics at the University at Buffalo is nationally recognized for creating new methods that advance scientific discovery and practice.
The University at Buffalo is a great place to come for biostatistics. We're ranked number 22 in the country for biostatistics departments within a school of public health. We have very established faculty. 3 of us are fellows of the American Statistical Association. We also have 3 faculty who are full-time clinical teaching faculty, and the students love them. We are the only PhD in biostatistics granting department in the entire SUNY system, and we have connections with the Institute for Artificial Intelligence and Data Science. We are creating a Center for Biostatistics Research Collaboration and Data Coordination, and many other research capacity building efforts that will allow us to have key roles in important studies as we move forward.
JSM is brought together by an incredible set of organizations in the US and beyond. To find out how JSM is keeping statisticians across the world, we caught up with some of JSM's international partners.
I represent the International Indian Statistical Association.
Student representative of Korean International Statistical Society.
I represent the International Chinese Statistical Association.
JSM is one of the largest gatherings of statisticians in the world. For me personally, what I get out of the meeting is I learn about latest developments in the field.
JSM is time to organize and refresh my research from the past year. So by presenting my research output through the JSM, I can validate my method from other researchers.
It's important for me because I want to know what's trendy. I want to know what my colleagues in my field are working on. I want to make new friends and get connected with my old friends.
Well, statistics has no boundaries. Our association especially connects with statisticians from all over the world, from India, from UK, from USA. We have conferences all over the world, just bringing the people together for the future of statistics profession.
By meeting in person, we can actually strengthen our relationship, and also I believe that this kind of bridging helps Korean society become more global and also contribute to the wider global community.
So it includes members not only from the North America, but also from mainland China, Taiwan, Hong Kong, Singapore, well, everywhere in the world.
They can come and visit us here. We also have a nice website, internationalindianstat.org. So they can visit there and become members of the association.
You can find more information by visiting our booth, and also you can visit our website for the continuous updates.
Go to our website, icsa.org. Yeah, that's the best place to find all the information.
As we continue to focus on health, let's take a look at health equity and the ways that statistics can help us better assess and understand the challenges that lead to poorer health outcomes. Here at JSM, Maricela Cruz and Yates Coley will be presenting a paper on this very important topic. Thank you both so much for joining us.
Thanks for having us.
So you're going to be talking in your session about how structural racism can impact clinical prediction models. Tell me a little bit about how this work got started and why it's so important.
There are prominent examples of prediction models that are disproportionately directing resources to privileged groups of people and ignoring underserved populations, thereby increasing or widening the gaps between these two groups in terms of healthcare access and health outcomes. Because of this, there's a lot of concern about the potential of clinical prediction models and really other artificial intelligence tools that are trained on observational data like electronic health records data to make the health disparities in the data worse, and we share that concern.
Yeah, we're particularly concerned about prediction models for suicide risk and self-harm. Some of our prior analysis found the potential for differences in performance of suicide prediction models across different racial and ethnic groups. And then we're worried that using those models with those differences could lead to wider gaps in access to mental health care that's affordable, evidence-based, and effective. So we wanted to dig into the potential for structural racism to impact suicide prediction models a bit deeper so we could understand possible bias mitigation strategies and inform decision-making about whether and how to use these models in clinical practice.
Really important work. Let's start with just a basic question. How are you defining structural racism in your line of work?
Well, here we're thinking about structural racism as structural barriers that limit folks' access to evidence-based quality mental health care. So for example, we know that Black patients are less likely than white non-Hispanic patients to initiate psychotherapy or antidepressant treatment after an initial depression diagnosis. So this is driven by structural racism and the longstanding barriers that Black people face when trying to access mental health care. And we also know that even racial differences in preferences about types of treatment are also driven by this legacy of mistreatment when trying to seek mental health care.
Talk about some of the challenges that you're seeing and how you're overcoming those.
Yeah, so some of the challenges in identifying structural racism in clinical prediction models really lies in what we can actually observe in the data. Structural racism is difficult to see in electronic health records data because really what we observe is like high-level details of the care that's delivered. And a lot of what we observe is based around money and billing, since electronic health records data were created with that in mind. So because of this, it's very difficult to determine if someone was denied care because of structural racism or a structural barrier, or if really they didn't need that care at all.
Talk a little bit about the approach you took with these models.
Yeah, so here we conceptualized the impact that structural racism in mental health care has and how it's reflected in our electronic health record data using kind of common statistical tools that we're familiar with. So we think about structural racism as causing missing data, outcome misclassification, predictor misclassification, risk modification, interactions in our data set. So this way we're able to approach a really complex problem like structural racism using statistical tools that we're familiar with.
How have you brought this together into a simulation framework, and how effective has that been?
To bring this together into a simulation framework, we have started with mental health data from white non-Hispanic people and then randomly created two groups, one group representing a privileged group of people or a population, and another representing a disenfranchised population. We then actively create changes to try to emulate a structural barrier for the disenfranchised group so that we can see the impact of this barrier on model performance.
Yeah, and so far we've been successful in generating data that reflects singular or individual structural barriers to care, but ultimately we want to expand our data generating mechanism so that we can reflect multiple co-occurring types of structural barriers to care, because that better reflects what happens in real life. Patients of color aren't experiencing structural racism instances in isolation, but rather many things are occurring at once, and that's creating the current system we have where there are worse health outcomes for people of color.
Thank you both so much for your time. Appreciate it.
Of course.
Next up, with another group doing great work to help improve lives, let's go to Clemson University Center for Public Health Modeling and Response.
The mission of the Center for Public Health Modeling and Response is to develop data-driven approaches to assist health organizations and communities to respond to emerging threats. We have over 30 dedicated research faculty, staff, postdoctoral fellows, and graduate students who have developed numerous innovative methods that are also published in high-impact journals. The center has received approximately $30 million from the NIH and the CDC for several projects to improve public health outcomes. Our center integrates social media data, wastewater samples, and electronic health records into statistical, mathematical, and deep learning models to predict and forecast outbreaks, which is used for real-time decision support by our state health department and health systems for outbreak response.
Health data is a valuable resource as statisticians collaborate to help improve the health of everyone. But the risk of breaching the privacy of individuals in using it is essential to consider. To look at an innovative way to preserve privacy but maximize the value of this data, we're joined by Brown's Rebecca Hubbard. It's so nice to meet you, Rebecca. Thanks for coming on.
Very nice to meet you. Thanks for having me.
It's one of those things as statisticians, you want to protect the privacy, but you also are trying to do effective research. Talk about some of the risks and how you get around that.
So every time we're doing analysis with real health data from real people, we need to make sure that there are really careful privacy controls. So one of the things I like to think about is the minimum necessary rule. So whenever I'm doing research with real patient data, I try to make sure that whatever I'm using includes the most minimal amount of information that's personally identifiable possible. However, in addition to wanting to use the data and trying to learn from it as much as we can, there's a mandate to share data with other individuals. So if we're taking, for instance, research funding from the NIH, they expect that we're going to make that data available so that the public can benefit from it broadly. So if I'm doing research with personally identifiable information from the EHR, and I want to share that with other people so that they can also make use of this resource, I can't just take the data sets that I've collected from their electronic health records and just put them up on a website or send them in a data file to other researchers. So one of the ideas that's out there to try to facilitate data sharing for these protected confidential data is this idea of what if we could identify the underlying generative model that gives rise to the data, and then rather than sharing the original source data, we could generate new synthetic data which preserve the relationships that we've observed in the real data, but don't belong to any real individual. So then we can share that information, other researchers can learn from it, we can continue to look for relationships in the data, but we're not potentially releasing private identifiable information.
We were talking off camera, a lot of challenges, that fine line you walk between making sure you've ensured that the data is removed from the individual, but it still has value and there's accuracy there. Talk about that challenge and how you're navigating that.
Yeah, so that's the real tension, because in order for these synthetic generated data to be useful, they have to preserve all of the information that was there in the individual original source data. But if we really preserved the totality of that information, we would just be replicating the information from those original individuals. So it's a tension between wanting to generate data that still preserve the relationships that we're interested in, but on the other hand, disguise the identifiable information about specific individuals. I don't think that there's a good solution to that problem yet, and it really depends on the specific use case of what we're planning to do with the data, where you want to land on that spectrum between identifiability of private information and preserving all of those relationships that exist in the information that we're getting these relationships from. So as statisticians, we use synthetic data for things all the time for years, and we don't usually call them synthetic. We'll call it imputed data or multiply imputed data, but what we mean is fake. We've just generated it from some kind of underlying model that we've constructed. Looking towards the future, this type of generative model is what underlies all of the AI technologies that people are so excited about right now. And there definitely will be more opportunities. There will be more generative models which can better replicate these relationships all the time. However, I think it's very likely that there are theoretical limitations to how faithfully we can reproduce the data while still protecting privacy. So ultimately, I think we probably can come up with the best model in the world that uses some super powerful machine learning or AI technology, totally recreates the original source data, but also does not protect privacy. So, I think ultimately there's sort of a ceiling that we're going to hit in terms of using these data for the purposes of public release and privacy preservation. That is something that's going to be ongoing, and we're going to continue to learn how to navigate.
Such an important topic and important work you're doing. Thank you so much.
Thank you.
Yes, it is good to know there are experts out there working to keep our data safe. Well, that finishes things up for episode 2 of JSM TV. And with that, we've had some great insights into how statisticians are making a real impact in the field of health. Tomorrow, we set our sights a little wider to look at a broad range of areas, including how statisticians are helping Olympians go for the gold. And whether you're here in Portland, Oregon, anywhere else in the world, there are lots of ways to watch JSM TV. Watch it on screens around the venue, in your room in select Portland hotels, via the JSM website, or on our YouTube channel, including extended versions of all our film series features. And make sure to connect with us online. Until tomorrow then, make sure to catch up on all of our content, especially those extended features you can check out on our YouTube channel. Bye for now.